Okay, well, maybe I'll get started here. I just wanted to welcome everyone. Thank you for being here. If you don't know me already, I'm Amy Roble. I am the co-founder and chair of KARES, and I would like to hand this over to Julie, who's going to introduce our speaker today.
Hi, everybody. I was just putting up my little clap hands for the people who started KDM5C. So um, that's what the little clap is for, not for myself. So my name is Julie. I am a parent of a kid with KDM5C. I will always forever be grateful to this group because I first learned about PDA in this group. And it so defines my child to a T. I like just was so over the moon to figure out that this is what was going on. And Dr. Klein, not only did he go to the same graduate school that I did, we worked for the same employer for a bit. And I went online to see if anybody specialized in PDA in the Bay Area, and his name popped up. Um, and I had met with him before, but in a different context in terms of, could you just please tell me what is going on with my kid? And I didn't know about the PDA subset yet. So I'm so happy to have him here with you. I'm going to read a little description just of his accomplishments. So he's a licensed clinical psychologist who specializes in parenting as well as assessing neurodivergent adults and children. He currently runs a private practice in Oakland, California, where he does counseling with individual adults, couples, and parents, as well as evaluating adults and children for autism, ADHD, and other forms of neurodivergence. His primary interests include neurodiversity affirming care, parenting challenging children, pathological demand avoidance, social justice, trauma, education, and advocating for the rights of children. And so I just, want to highlight that parenting challenging children piece. I have found and experienced that parenting my KDM5C child is challenging to say the least. And I don't know if you guys have had experiences like me, but it was so lovely to find someone who could help me with this. So with that, I will let Dr. Klein take over.
Well, thank you so much for inviting me to present in your group. I really appreciate it, Julie and Amy and Melissa and you as well. And thank you so much. So feel free to use the chat, though I will not necessarily be able to monitor the chat so well, but feel free to use the chat. And at some point during this presentation, I might even ask you to. So this is about understanding PDA in neurodivergent youth. And, some of you might already know that PDA stands for pathological demand avoidance, and sometimes also referred to as a persistent drive for autonomy. I want to just go over a little bit of the history. I'm going to go over descriptions of the PDA profile. I'm going to go over ways of sort of understanding this form of neurodivergence. And I'm going to also talk about ways to intervene and ways to support your child and ways to think about all of that. So this originally came out of the autism space. So there's a clinic, Dr. Elizabeth Newsom in England back in the 80s. A bunch of kids were brought to her clinic saying, "Oh, I think this kid is autistic or has Asperger's," was the diagnosis at the time. Um, and Dr. Newsom started noticing sort of a subtype, which it was eventually proposed as a subtype on the autism spectrum, PDA. But I think what might be a better way to think of it is sort of a neurotype that can absolutely kind of occur outside of the autism spectrum or have overlap with the autism spectrum. So I would really think of this as sort of a neurotype that is, and it's not actually an official diagnosis in the diagnostic category that we as psychologists and those in the medical field use to diagnose. But in the similar way, like sensory processing disorder, SPD, some of you might have heard of, is not an official diagnosis, but it's kind of thought of as a neurotype. So I think of PDA as sort of similar to that. So that's one thing I wanted to start with. And so Dr. Newsom in the UK started noticing, okay, well, we have like some kids that are more obviously autistic, some kids who maybe fit the Asperger's criteria a little more easily. PDD-NOS was sort of like a large group of kids who didn't quite meet that category either. But then she adds kind of PDA. It's like, oh, I think this is actually yet another subtype under this autism spectrum umbrella. So even though this has been around since the 80s, which actually is not a long time in the grand scheme of sort of in the history of psychiatric diagnosis, it's really in the last like 5-ish years that it's actually become much more popular. I think it would have been rare before 2020 for a parent, maybe 2019. Rare for a parent to come across this online, and now very, very common for parents just trying to come across this more and more. So something's really shifted. So some of the core features of PDA that I think are important to highlight here are that this is really an extreme anxiety-based need for control and autonomy. These are kids and adults who have highly sensitive stress response systems, can be very kind of easily activated, easily dysregulated, easily kind of in what we might call having hypersensitive neuroception, which refers to a very automatic and unconscious system for detecting threat or safety. And the perception of a loss of autonomy, right, whether it's an actual loss of autonomy or perception of a loss of autonomy, we can sometimes see really extreme responses in order to regain that sense of control or avoid situations where we might not have that sense of control. So in some cases with the PDA neurotype, the social differences might be more subtle. I think role play and pretend can sometimes be quite extreme. Like, oh, I can't brush my teeth because I'm a cat and cats don't need to brush their teeth. Or like, I can't walk to school because, I'm a seal and I need to be in the water all day or whatever, right? It's like, sometimes avoidance of demands can be quite extreme. Sometimes in the autism spectrum space, at least we hear, and this is also true in ADHD, we hear this concept of hyper-focused interests, like getting really, really fixated on certain interests. In the PDA space, it can be a little more likely for that object of fixation to actually be a person. And again, this is really an inability to comply with the everyday demands of life. And these are situations where, sometimes kids who can't make themselves do things that even they themselves want to do. I'll give a quick example there that I like to share that comes to mind, which was years ago, a parent told me that their kid who had been having a lot of trouble getting their math homework done, so their 10-year-old or something. And, and finally the kid was gonna, work on some math homework, and he was going upstairs and he was gonna start working on it. Like finally, the parent didn't know that he was gonna go work on it. And so as the kid's walking upstairs, the parent says, hey, don't forget, you got to do your math homework. You really got to get that done. And then all of a sudden the kid, again, that sort of like all of a sudden this did not feel like a choice that the child was making, something that the child felt like he had control over. And then he was not able to do his math homework, right? Even though it was something he wanted to do and get done. So, and so I think a lot of these kids really don't maybe see kind of the way we typically might think of as like parents or teachers or school administration as like in sort of positions of authority. I mean, these kids might really not see true differences. They might really need to be explained or have a hard time accepting why, just because you're the adult, do I have to do what you want to say or what do you say? School refusal is very, very common in this population, right? So these estimates range from 40 to 70% of kids with a PDA profile are having, needing to be homeschooled or really having extreme difficulty attending school. So I think that's an important piece here. So one of the things I want to do here is talk about PDA versus other types of demand avoidance, because demand avoidance is super common in all types of neurodivergence. And even outside of that, there's demand avoidance can be a part of life. So maybe in the chat here, if anyone can access their chat, to say like what might be some examples of reasons why you telling your kid to go brush their teeth or go do their homework about why they might not do it. Like what might be getting in the way. I'm kind of thinking about, and it could be anything that comes to mind. Because again, there's lots of reasons why these things might be hard that don't have to do with demand avoidance, right? So see a couple here. So anxiety about not being able to perform, breaking the routine. Okay, those are great answers. So I'm going to go over a couple here, right? So lots of different reasons. So we have maybe there's an unpleasant sensory experience. So I don't want to go brush my teeth because I can't stand that new toothpaste you got. The idea of initiating tasks, right? So like I'm doing one thing, oh, I'm supposed to stop doing that one thing, switching from one task and starting another one. Really common executive functioning deficit, difficulty with attentional switching or stopping one thing and starting the next thing. Anxiety about not doing well, somebody said that. Shame can connect to that. A difficulty tolerating uncertainty, the very common reason we might avoid something. Again, sort of just too emotionally dysregulated or having a hard time being flexible, having a hard time sustaining attention enough to sort of take in and know what the demand is, or wanting to avoid the demand because it's boring. And we know, for kids who have executive functioning challenges, forcing themselves to pay attention to things they find boring are extra hard. But again, so there can be any of those elements can be true for any neurodivergent kid, PDA or not. I think one of the things that is different is sort of how extreme the demand avoidance gets. And also, again, this idea of like, well, when there's a lack of control and choice, that is really what a core thing that will trigger the avoidance. And demands are everywhere. They can be direct demands, pick up your shoes, go to school, do your homework, take a shower, all of the things that we as parents might tell our kids to do. There's also very, indirect demands that come up. So like the internal demands, for example, the experience of feeling hungry, or having to go to the bathroom or feeling sleepy, right? So that can be experienced as a demand for some folks, as for some PDAers who feel like, well, I had that feeling of feeling sleepy or being hungry. Well, now I'm just not going to do it because, like, again, that didn't feel like my choice here, right? Like, and again, with PDA, like typically when people think about PDA, they think of externalized expressions of PDA, which means outward behavioral defiance, oppositional behavior, pushing back, things that we might see as sort of more obvious forms of dysregulation, more obvious behavior challenges. But there can also be internalized expressions of PDA, which really refers to kids who are kind of masking some of their challenges. So they're kind of maybe pretending like, okay, and then they're finding ways to kind of avoid, to get away with not doing what we maybe had asked them to do. So there absolutely can be a lot of different ways that PDA can be expressed. Again, the most obvious being these externalized expressions, and then again, internalized expressions can be common too. And there's a lot of causes of dysregulation in neurodivergent kids, right? So there can be anything from a sensory trigger, which maybe leads to a lowered frustration tolerance, right? So for example, I had to spend the whole day at school and there was an assembly that was kind of loud. And then like, I had to do this, and that sort of stirred up my sensory system. So therefore, my capacity to tolerate the frustrating thing of homework after school is less because, I've been, my sensory system has been triggered. Another common cause I see a lot is this gap between expectation and reality, where I think it is like a prediction error, like when we sort of expect something to happen, like, oh yeah, every day when mom gets home I get like a cookie, let's say, right? And then like, oh shoot, we are out of cookies today, right? So what does it take to be able to tolerate that? It takes flexibility, it takes ability to manage frustration, self-regulate. So this is a really common characteristic of PDAs, and all neurodivergent kids might have challenges there. And just generally navigating a world designed for neurotypical people, right? Where maybe there's an over-reliance on language and the kid has trouble processing language, or maybe there's not an attunement to like, well, actually this building shouldn't just have fluorescent lights because that messes somebody's sensory system up. That can also be a contributor to dysregulation. And again, this piece around sort of parental expectations, or adults or teachers or therapists, any adult expectations, maybe not meeting or matching the child's abilities. And in fact, there's studies, and one big study that came out where they found that half of parents actually believe that their children had more ability to manage and control their emotions than the kids actually did. And this is something that I think is an important piece. And we can talk more about this. And by the way, for anyone that came late, we are going to leave 15 minutes at the end for you guys to ask any questions you want. So I'm going to run through this presentation. Feel free to throw any questions you have in the chat, if they come up now, but I'm going to be waiting to answer them until 4:45 Pacific time. So this concept of a hidden disability can be really important, I think, in PDA and other forms of neurodivergence, where there might really be invisible stressors that are occurring, let's say, throughout your child's day. Again, I gave that example of like, well, there was maybe a schedule change that was difficult. I had to be in an extra loud cafeteria. The classroom was kind of chaotic and the kids didn't follow the rules. Or I didn't really get to choose what I did on the playground, but I didn't want to, have a meltdown in front of my friends, so I kept it together. But these are not always going to be obvious. For example, to teachers or school staff, in some cases, some of these sort of things that are actually quite stressful for kids, which is why sometimes we see kids, and this can be more true in PDA, where they have kind of keep it together in some settings, and then lucky you as parents at home, you guys kind of see the most of it, right? Which I want to be really clear, and hopefully all of you guys know this already, but I want to be really clear that we do not want to interpret that as you as the parent being the problem just because your kid shows you the most issues. And I think that is something that is a huge pet peeve of mine. I see that happen a lot, where parents might get blamed for the problems the kids having because the problems don't happen with another person. But honestly, some kids who, again, are exerting a lot of effort that others don't see to keep it together in some settings, but then their kind of defenses are down. They're a little bit more willing to show their true selves and all of the feelings that come with their true selves to parents. So that is a very common thing. So I like to talk about this idea of like, well, what if a disability was more visible? This idea of like if your kid has a meltdown when it's time to put away the iPad, right? Versus like your kid, kids having like a huge aggressive outburst or screaming and crying, can be hard to really sort of empathize that. Versus like if your kid was having a seizure, that's a lot different. We have a very clear kind of medically based reason for the reason why a child might be having some kind of event that's going to take, let's say, 10 minutes before the child comes to, becomes more, regulated and with it again after a seizure. But, on a neurobiological level, of course, seizures and meltdowns are different, but this idea of sort of intentional control is very much the same, is very similar, where similar to a seizure, kids are honestly can be losing abilities in those moments. This is really important to keep in mind, because I think if we view these things as sort of an intentional, like, okay, I'm trying to just melt down to get what I want, I mean, that can be a sort of a problematic framing when we know sort of the more recent neurobiology suggests that like kids are just not, their prefrontal cortex is which sort of controls your ability to self-regulate and plan and problem solve and use language and effectively is really kind of goes down in these moments. It's not online in the same way until a kid gets more regulated again. And so this is where things like PDA and certain disabilities can be kind of unseen, right? And that parents might be seeing as undisciplined or more likely to be judged, or in even studies showing that parents developing low self-esteem because of some of the parent blame judgments that happen. So that's a really important piece I wanted to put in there. I think it's really critical to understand PDA for a lot of reasons. One of which is, I mean, a lot of parents are kind of describing a light bulb moment, like, oh, this is where, why the interventions I've been trying, like, I just need to be more consistent with the consequences, or I need to just be more consistent with, like trying to do a reward for this thing, right? So like these are behavioral strategies that sometimes work for some kids for sure. And although I would argue like they tend to work for easier kids, but there are kids again where things like this idea of like implementing a behavior reward system, for example, really threatens that sense of autonomy control, and it doesn't work, right? So these devices really might not work. And so some parents are kind of coming to PDA because they've realized like, I really haven't been getting the right advice. This isn't stuff that has been working for me. And some parents know in their gut that something just isn't right here. We also know, and this is true of genetic differences, this is true, in general, where like in autism, we've sort of broadened our concept of the autism spectrum to encompass more and more people. And I think that one of the reasons why understanding PDA is important is that sometimes the autism spectrum diagnoses are getting missed. And, again, there's some debate about whether we considered PDA an autism subtype or whether we consider it sort of a separate neurotype. I'm not sure how much that matters as long as we're understanding the underlying challenges and what to do about them. But I definitely think that, again, because of some of the stereotypes about what autism looks like, someone might just see some of this oppositional defiant behavior and say, oh, that's ODD, that's oppositional defiant disorder, where actually, again, if we look at sort of what some of the root causes are, we're going to talk more about that as a way more important way to sort of understand why the child is getting to the place that they are. And honestly, I truly believe that PDA strategies really may be better for everyone, right? So it's not, and I'm going to talk more about some of the strategies, but it certainly requires sort of a rethinking of our own, usually requires rethinking of how we were parented, and we're trying to parent in a different way. And it certainly takes some sort of outside the box thinking. So when we think about PDA strategies, there's the acronym PANDA that the PDA Society, which is in the UK, they have this on their website. That is a really excellent resource to talk about some of the strategies used with PDA. So the P for PANDA meaning refers to picking battles. So this is sort of looking for opportunities to give your kids choice and control, right? I don't know, some of you might have heard of a low demand approach. There's a psychologist, or actually she's not a psychologist, but a parent coach named Amanda Diekman, who talks about low demand parenting in the PDA space. What I would actually, I think I like all of that, but I think that it gets stereotyped as saying, oh, well, you're just eliminating all demands from your child. Like that's not right. And what I would say is actually it's more attuning your parenting, kind of this concept of playing with the cards you're dealt. That again, there's not a ceiling on development, but what happens is I think when we expect a kid to be up here and we meet them up here and we're trying to putting these demands on them as if they're here, like that's where a lot of problems can come from that. Whereas if we kind of meet them where they're at better by lowering demands, creating more of a foundation of regulation, then there tends to be more room to start growing and kind of coming back up the ladder to sort of increase the demand. So I think it's really important looking for opportunities to give your kids a win, quote unquote. This is also focused on managing anxiety, sort of low arousal, which means prioritizing, sort of trying to not have conflict. Again, trying to be more to anticipate problems that are happening. Looking at meltdowns as actually panic attacks, where a kid is again not having control over their behavior versus an intentional way to try to manipulate others or something like that. You often hear. Using more negotiation and collaboration. It's really important. So this idea of proactive problem solving, right? So it's like if you are having a child who's sort of, getting to a point where there's big meltdowns, big issues coming up, um, how do we sort of say, okay, every time or the weekends they're super unstructured, it seems like this problem tends to happen, or every time dad gets home, like this tends to happen. Like, can we sort of take a big picture look and do some a little proactive problem solving, right? Like, not just trying to think about like what are some other things we can try for kids who are verbal and can be involved in that conversation. That can be really important, right? So we are giving kids a say in trying to solve their own problems, because again, with the sort of PDA neurotype, there's that need for control and need to have say, not just for us to do to them by developing some strategy, but trying to include them as a way to sort of come up with some mutually agreeable solutions. And that there's a psychologist named Ross Greene who wrote a book called The Explosive Child that is really gets at that I think is really good with this population. Another thing we hear a lot about is this idea of sort of being more thoughtful with your word choice. So avoiding direct demands and using more declarative language, like, oh, I see your shoes are over there. Let's say you want your kid to like get to school or something, and when when they get to school, they get to sort of run around the playground. Some schools allow that. My kid's school does not anymore. But some kids are allowed to run around the playground when they get there. So instead of said, hey, we're going to be late, get your shoes on, do this, do that. Those are demands, which again might activate a child's threat response. Whereas if it's, oh, I see your shoes over there. Oh, I wonder if so-and-so is playing on the playground, or, oh, I wonder if we're going to listen to that song again on the way to school. Like, you're kind of like, you're still trying to transition your kid, but it's doing it in a way that sort of is giving them more of a sense of choice and autonomy, as opposed to you just telling them what to do. So these are little strategies that we can try. And in general, I think kids with the PDA neurotype might require us as the adult, or the parent, therapist, the teacher, using more humor, using distraction, using novelty. And again, we really want to be flexible. And I think this gets at sort of prioritizing connection over control. Here on this slide in the third, I have control over comfort, right? So in general, so there's been sort of, many of you have heard of the concept of neurodiversity. We hear sort of neurodivergent adults like speaking out about treatment. This is very true in the autism space, but kind of can occur everywhere. And so we're looking at sort of how can we move from trying to control, a child who might be having, some really difficult behaviors. There might be sort of a tendency like, oh, we see difficult behaviors. Again, let's implement some kind of behavior plan. Let's do something to the child to try and fix this. And then again, that is going to work for some kids, and it is not going to work for others, especially PDAs who might require more comfort, more of a relationship first mentality. I like this concept of won't versus can't. So what this gets at, it ties into what I was saying before, where a child who won't do, if we view the child as someone who just won't do what we want them to do, they just won't transition when I say it's time to transition, they won't, keep it together when it's time to get off the screens, and they won't do this. Or is this a child who's having difficulty with, or is a child who can't regulate their emotions or switch from one task to the other right now, because right now they haven't developed the skills yet to do some of that. Thinking about this concept of like, well, what is the behavior we're seeing versus why is that behavior happening in the first place is an important shift that we want to think about. So, for example, I hear work with a lot with families, and I hear, oh, I got an email from the teacher about like my kid threw a pencil at this kid, and then they eloped from the classroom, and on Wednesday, and then on Thursday they pinched somebody at recess. So it's like that's what happened. So it's hearing what happened. I'm way more interested in hearing, well, why did we get to that point? Why did we get there in the first place? Because if we don't understand why that happened in the first place, then we're really missing an opportunity to try and again be proactive and prevent them from happening again, help this kid meet their needs in a different way. We're also looking at moving from external, looking at what the external behavior is. Like, I see your child is, is running out of the room, to what their internal experience is. Oh, they're feeling that loss of control because, like, we didn't let them write about Minecraft today when maybe we should have let that one go. And, like, instead of trying to make them write about this other thing, we are going to give them a little more choice and autonomy here. But again, if we're not focused on internal experience, we might not know that. We might just see the kid who bolted out of the room. Looking again, and I think that sometimes I feel like adults can be inflexible in the face of big behavior challenges. So I want to move to, so it's really asking adults, parents, therapists, teachers to be way more flexible in the way that we view these challenges and the way that we respond to them. I think that sometimes there is sort of an over focus on independence. And now I am not against independent. Of course, that can be a perfectly reasonable goal, right? But we want to be careful not to sort of, again, have that expectation ability mismatch. And again, it can be okay if some people are dependent on others. All of us are dependent on others in many ways. So sometimes that sort of hyper focus on independence can actually be a problem, even if, of course, we want to sort of take steps to move in that direction sometimes. And then again, in the neurodiversity movement, of which I think PDA really kind of comes out of, in the sense that as we sort of shifted our views of sort of understanding neurodivergence and different kids with different profiles, I think it's sort of challenging us to not so much focus just on changing the child, right? Like, you need to get your act together. You need to fit into this box. Like, you need to transition when the other kids transition. You need to, do this and that, versus changing the system around the child, right? Oh, okay, well, maybe, he can get to school at 8:45 instead of 8:20, and maybe that's an accommodation. Maybe he can't, to avoid the sensory overwhelm of the morning bell, or to deal with extra time because he has trouble with attentional switching and executive functioning. There's millions of examples of that. But again, it's like, how do we look at not just sort of like, oh, we see a problem, let me like kind of have everybody focus on the child and what that child needs to change, versus, again, taking a more systems view of like, well, what in the world around the child can change in a way that supports this child's development and regulation. So, what is the quote unquote right approach? I put that in quotes because I don't think there is one right approach, right? But here's some kind of things that I think is important to keep in mind. And some of the stuff I've touched on here. I think sometimes when we have children who have various diagnoses, there's a very understandable and valid fear of the future. And that I think is important, and then should not just be sort of swept away. Like, I totally get that. I think what can happen is that sometimes our fear of the future can cloud our judgment in the present in a way that is not actually helpful to your child or the situation. So again, I'm getting at, are we having that expectation ability mismatch where we need to kind of come down to meet a child where they're at before we take them where they need to go? I think parents, I think it can be really good to reflect on your own parenting history. Like, if I had done that thing, what would have happened to me, right? And is my child the same as me, or is my child a bit different than me? And always our children are different than us. Of course, genes are real, and of course they are of a lot of similarities, but there's also significant differences, of course, right? So kind of really thinking about the ways you're similar and the ways you're different than your child. How are you parented versus how do you want to parent? And again, views on parenting have shifted over the years, for sure, right? And you see that in sort of more a move towards more gentle parenting approaches, and this kind of thing. And I think, again, understanding what I mentioned, this concept of a hidden disability earlier. There really are hidden stressors for the PDAers and for other neurodivergent kids where we just aren't seeing stuff that happens throughout their day, maybe, right? Again, maybe it was not enough choice. Maybe it was that sensory experience. Maybe they were being forced to sit through something boring and they just have a much harder time doing that than neurotypical kids. Whatever kind of goes into that emotional backpack, throughout the day, and then kind of coming back, and then all of a sudden you guys see the worst of it, like we talked about before. So how can we make that disability, for as a parent, like how can that disability be more visible to us? And by that I mean seeing the underlying challenges, seeing the hidden stressors for what they are. And then again, I think having that relationship first mentality, right? So like it can really be hard. This concept of like children should, I am the parent, so my children should listen to me because I am the parent and because that is how authority works, right? Like that logic is just not really going to resonate with a pediator at all. In fact, is going to activate their stress response. And so I think really this type of approach, again, it requires way more flexibility and really for us to challenge our views on parenting in a broader way, right? And this is not the same as saying, let your kid do whatever they want and control you and be unsafe. And of course, there are still boundaries around safety, et cetera. But again, it's like, how do we sort of take a different approach to parenting that lets kids have more control in ways that are safe? And we're striving towards that just right challenge, like I said before, right? Sort of like, how do we get to a place of better regulation before we move in a different direction? And one of the things that I like to say, which is way easier said than done, is kind of coming to a place of radical acceptance for the things that we can't change. That this is a messy and ever-changing process of parenting, parenting neurodivergent kids of genetic differences, of course, right? So how do we get to a place where I think sometimes parents fear, like, oh, if I just accept things where things are at, then like I'm not going to be helping my kid. And I would say, well, actually, you can both help your kid and accept where things are at. It can take some work, but it's this idea of sort of separating yourself, your own happiness and well-being from your child's progress. Now, I had a very hard time with that with my own child, early on with some very serious physical issues. So I get that this is not an easy thing. But I do think it's worth reflecting on and, really understanding what your child's window of tolerance is. So this concept of window of tolerance really means it's kind of a metaphor for like a state of balance in the nervous system that allows people to function at their best, right? And I think there's one of the problems I see is that, again, we assume that some of the expectations and demands we place on our kids are within their window of tolerance. And maybe sometimes they are kind of trying to keep it together because they want to please you. And they're masking some of their internal distress, or they don't want to have a meltdown in front of their peers, right? But actually, they're still being asked to do something that is outside their window of tolerance, which can have consequences, right, of stress, anxiety, depression. So looking at how do we get into that window of tolerance, that optimal zone where, people can cope with the demands of life, and everything impacts that: sleep and appetite, stress, sensory stuff that I talked about before. So when we're finding the right balance, is this ever always changing attempt where we're sort of stretching. I like to say stretching, but not overstretching. We don't want to tear the hamstrings. We don't want to, it's like this concept of gentle stretching. I think that is what is often missed with PDAs and other neurodivergent kids, that we are not quite understanding all the underlying challenges. We're not quite meeting them where they're at as much. And we might really not be able to reduce all demands. Very common for one parent to have a harder time reducing demands than the other. That's like probably 2/3 of parents I come across. I think, like, again, schools, I'm sure many of you had experiences in the schools where, you've had to advocate for your kids to, for them to do A, B, C, and D. That can be a process. This can be difficult, right? But the things that we can do is we can go into that stress detective mode, right? Like, again, what are those hidden stressors that we weren't seeing? We can do, I mentioned before, the psychologist Ross Green, this concept of collaborative problem solving, identifying the underlying challenges, and actually trying to engage in conversation with your child to come up with mutually agreeable solutions to problems ahead of time that you have identified as a priority. And tabling other expectations. Tabling is different than throwing them away forever. We might say, you know what, too much difficulty going on here. I'm going to focus on a couple of these priority issues here. Other things I'm going to let go. Once we can get to a better place with these issues, then I think we can start bringing in some of this other stuff. And again, you know, I think for any parents who are going through a particularly rough time, I do think it's important, and any feelings, again, I think should be processed, should be allowed, should be validated. We also want to know that these are not permanent. The particularly hard time your teen or young adult or young child, or however old they are, like, typically we really see these as sort of windows in time that we do come in and out of, and I think that's important to really keep in mind. So just a few resources here before we move to questions in a minute or two. So the PDA North America started around 2020, I think, along the same time your organization started, and around 2020, 2021, 22. The PDA Society, that is probably, if you just Google PDA Society, you will find it. It's from the UK. That is probably has the most information about PDA out of all of these resources by far. There's lots of people in the social media world, parent coaches, some of whom are also clinicians, that are also talking a lot about this and have really great information. So Christy Forbes, who is with Intune with PDA is her company. Casey Ehrlich at Peace Parents. I mentioned the name Amanda Diekman at Low Demand, who talks a lot about low demand parenting. Sandra McConnell, PDA Mama Bear, is what she goes under. So there's a lot out there to learn from. There's countless others, but those are just a few highlights of what comes to mind. So, we did it, 4:45. Okay, so wanting to leave some room for questions for anybody that has